A very good evening to all the participants. Welcome to this 74th Wise Views Leadership Conversation. We are going to have a wonderful conversation with Dr. Jitendra Sharma. He is a very important person and very busy. He has consented to be part of this leadership conversation. Thank you, sir, and welcome to this Wise Views Leadership Conversations. At the outset, on behalf of everyone and on behalf of Professor Sainath, we would like to thank you for confirming this. And we are all set to learn from you, sir. I'll do a brief introduction and hand it over to you for your presentation. Yeah, this is Wise Views. This is the 74th. Every Friday evening, we have these leadership conversations happening. Today, we are talking about medical technology innovation in India, potential and pitfalls. So the first 25-30 minutes will be a talk by Dr. Jitendra Sharma, followed by Q&A for the next half an hour. So in all, it is supposed to be a 1-hour session. I take privilege in presenting this brief profile of the leader. Dr. Jitendra Sharma is the Managing Director and Founder of CEO of Andhra Pradesh MedTech Zone, AMTZ in short, which is Asia's first medical devices manufacturing park. He is the Founder, Executive Director of Kalam Institute of Health Technology that serves as Medical Technology Policy Institute to various departments and ministries of Government of India. He is Member Secretary of National Medical Devices Promotion Council and founder, chairman of 2 medtech incubators, MediValley and BioValley. He is adjunct lecturer at University of Adelaide, Australia, chairman of Indian Biomedical Skill Council, and a distinguished senior fellow at Niti Aayog, the National Policy Making Institution of Government of India. Dr. Sharma has been awarded the European Union India Young Leaders Award, the European Union Parliament, Brussels, and AAMI Lofman Great Batch Award for his distinguished work in medical technology sector. He is also known in the professional circles as the MedTech Man of India. We are extremely proud, sir, to have you with us. I would also take one more moment to introduce my colleague, Professor R. Prasad is the Director of Academic Wing at ICFAI Group. He also is a professor and course mentor for the latest program that we launched, the online MBA program. He brings 3 decades of rich experience with himself. He was an entrepreneur before, and he worked in the corporate and in the academic world, all put together 3 decades of wonderful experience that he brings to the table. He has a BTech from IIT Bombay and a PGDM from IIM Kolkata. And he published several articles, written several books, and presented many papers all across. Welcome, Professor Prasad, and thank you. So with this, I now request Dr. Jitendra Sharma to start his presentation. Sir, we are all ears. We are set to understand how this landscape is changing, and we would love to learn from you and later ask a few questions to clarify. Thank you, sir. Over to you.
Thank you very much, and I hope you can hear me loud and clear. Also, my knowledge and understanding is very narrow. It's only in the field of medical technology and healthcare, whereas your courses on leadership and strategy encompasses a large number of knowledge verticals. So what I'm going to do is I'm going to share my snippets on the discoveries and learnings we have in our sector, take few fundamental approaches from it, which could be generalizable across sectors. So the audience should feel free to ask questions even beyond medical technology, because these fundamentals are equally important for all sectors. I will not have a very bulky presentation. I would like to show you live CCTV cameras from my computer of production facilities rather than a boring presentation, and few online videos which you can see for yourself as well. I have been slightly into other meetings, so I have not read through the brochure of the program. Any sector, if we have to improve, that improvement can be done either to expand the sector or to remove problems that are inherent in the sector, or to bring better value of our investments happening already in the sector. Fundamentally, whether it is agriculture or dairy, defense or health, all of us are working in any sector for 3 primary reasons. Either we want to expand it, which means we want to add a new automobile category called electric vehicles. That's expansion. 2, we want to bring better value proposition. So we Uberize the vehicle or we bring Olas. We are not adding new vehicles, they existed. We are connecting demand, supply, aggregating, creating better value. Or 3, we are removing inherent problems of the sector like a safer seat belt or less heavy helmet for the bike. Broadly, if you look at any sector, these are 3 fundamental approaches. Let us start from this and look at healthcare. What is healthcare? Healthcare and what are its constituents? Healthcare obviously is an act of giving compassionate, science-driven, good quality intervention to either remove a suffering, whether it's that suffering could be a fracture or an infection, or to save life. Broadly, if we save life or reduce suffering, those interventions would be healthcare interventions if they are science driven. It's not that it is hypothesis driven or belief driven. If it is science driven, that science could be medical technology, that science could be nosod. Nosod is a science in which we use roots of plants to treat illnesses. It could be a homeopathy, it could be yoga, but it is science driven. Now you look at modern healthcare and what constitutes modern healthcare. Modern healthcare as we know it has 4 constituents. Walking into a hospital, you will find these 4 constituents. Constituent 1 would be, if you divide the healthcare into 4 parts, the part 1 would be the building and land. So if you imagine healthcare to be a big circle, one piece, 1/4 of that circle, 1 pie of that circle will be building and land. This building and land has nothing to do with healthcare. It is part of real estate sector. It has nothing to do with healthcare sector. In that building, if there were to be a school, it will be education sector. If it is a hospital, it is healthcare sector. This will never be in our control because it belongs to some other sector. Take the second piece, human resources. And we must apply these fundamentals of breaking a sector into its input parts to understand what we can do. Take the second piece, human resource. Nobody in the audience and no one from us would like to earn a lesser salary than what we are earning today, right? All of us would like our increments to happen every year. No one would agree for a lesser salary, which means knowingly we will never reduce the cost of human resources. We can only reduce the cost of human resource by removing some people. If we are able to manage 10 people's work by 8 people, or by bringing automation or robotics. Even then, it is not possible to reduce or control the cost of human resource in any sector. Number 3, what constitutes healthcare? It is the pharmaceutical products. India, thankfully, is a global champion in pharmaceutical products for last 3 decades. 1 out of every 5 medicines consumed globally originates in India, and India controls a huge amount of market, both internally and externally, international market in a big way. Yes, we do have challenges. Some of our active pharmaceutical ingredients, which are used in these drugs, still comes from outside India, but we are getting there. But that's not a point to worry, because globally, India is known for affordable, good quality medicines. The 4th component of healthcare is medical technology. India is 80% import dependent. Our medical technology imports into the country per annum this year, 2021-22, was 63,000 crore. 63,000 crore worth of import per year of medical technology. Our exports is 23,000 crore, but that is largely in low volume, high volume, low cost products like gloves, syringes, and so on. The low volume, high value products, right from ECG machine to oxygen concentrators used in COVID to ventilators and all that, earlier was largely imported. And that is why we developed medical technology through AMTZ. So, medical technology and AMTZ is not an act of arbitrary action. And what I want to tell students, leaders, entrepreneurs viewing this is that while your passion might be in electronics or chemicals or textiles or teaching, to reach that activity, you must do a segment analysis of your sector. If you love animals or you like animal husbandry or dairy farming or whatever you like, it is our responsibility, just like in India, many people check their horoscopes. We must, as professionals, check the horoscope of our sector. Where are we strong as a country and where are we weak as a country? Where our actions can make the country stronger without stepping on other shoes, without duplicating, without unwarrantedly competing. There is enough that can be done in a unique way if we were to do a segment analysis, a horoscopic view of our sector. So we did a horoscopic view of medical technology sector. Thankfully, in 2012, when I set up the first Center for Medical Technology at the National Health System Resource Center in the Ministry of Health, Government of India, and through that center created large number of medical technology programs like the National Dialysis Program, National CT Scan Program, National Teleradiology Program, National Pathology Program, National Mobile Medical Units Program. We were consumers of the sector, and therefore this analysis became clear to us that whatever we are consuming is important. Which means lesson number one that I want to share with the audience is, do the segment analysis of your sector and find out where the problem is. So where the problem is stepping stone, is the first step. The second step is why there is a problem. Where there is a problem is only the GPS location. But why is there a problem? So when you deep dive into any sector, you will realize that there are problems due to many reasons. Medical technology traditionally was imported into India primarily for 4 reasons. Reason number 1 is that medical technology is a very heterogeneous subject. A mask that we wear is a textile product but a medical device. RT-PCR kit is a biologic reagent but a medical device. X-ray machine is a radiation emitting product but a medical device. Spectacles that many of us wear is a polycarbonate product but a medical device. ECG machine is an electronics product but a medical device, and so on and so forth. Which means unlike pharmaceuticals, which is generally chemical based or biosimilar based, medical technology is a very heterogeneous group. To make any product, whether it's a startup or an entrepreneur, to make any product in this group requires high value scientific facilities which were not there in India. You need a femtosecond laser lab, you need an electromagnetic interference lab, you need an electromagnetic compatibility center, you need an accelerated aging center, you need a gamma irradiation plant, you need a 3D printing center, and so on and so forth. That was problem number 1. We solved it by creating AMTZ, and I will show you in a small video what AMTZ is. Problem number 2. And this is again a lesson for all sectors. If I have to make this product must conform to national and international standards. What if standards don't exist? That was the problem with medical technology. The Bureau of Indian Standards in 2014 had less than 100 standards for medical devices, and there are over 6,000 categories of medical devices. 1,500 categories out of those 6,000 categories, making the bulk of medical devices to the extent of 98%. We created an organization called Kalam Institute, which worked with BIS to write standards for 1,480 medical devices out of 1,500 devices in 4 years, making standards available in India for anyone who wants to enter medical technology. That was problem number 2. And this problem will be there in every sector. Problem number 3. What if I were to make this remote control? The spare parts and components required to make this remote control attracts a customs duty of 10%. And to import this finished product, the custom duty is 2%. Who will make? Making will be unviable. Because when we teach in colleges and universities, we teach the science of it, but not the art of doing business in science. Teaching science is different from teaching art of doing business in science. It is arts, commerce, and science put together. And that is society, where arts, science, and commerce thrive together for the sole objective of societal growth, safeguarded by ethics, law, and security. We worked with the government of India to advise on the correction of inverted duty structure. And in medical technology, 98%, 99% of the spare parts and components, which leads to production of medical devices, their basic customs duty were reduced to 2.5%, and that on imported finished products were increased to 7.5%, making viable to enterprise manufacture medical technology. And the 4th, what if you were to have a place like AMTZ, where you can make even India's first MRI, which we make here? What if you have the standards given by Bureau of Indian Standards for the making of the product? What if the customs duty on spare parts and components is minimized so that manufacturing becomes viable, but nobody buys the product? What would you do? What should be done to make products be purchased? There, in every sector, in many sectors, you can break the clientele into public sector, which is government procurement, and private sector, which is private procurement. The government sector will always buy the least cost, best applicable quality. Private sector will buy at any cost by freedom of choice. And this is important for the viewers of this audio. So the government of India in 2016-17 brought out something called PPO, Public Procurement Order, which states that if we invite procurement, RFP or tender for a medical device from multiple people, 2 people qualify, one is giving at 100 rupees, but it is made in outside India. Another is slated to be 110 rupees, but it is made in India. The public procurement order says that the maker in India, so long as a minimum percentage of local value addition is happening in India, who has quoted 110, is ready to match 100 rupees, ensuring that there is no loss to exchequer the procurer. A minimum of 50% of the contract should be procured from the Indian maker who is doing local value addition in India at L1 price. This solved the 4th problem. So if you were to provide right scientific facilities for any sector, if you were to make the standards applicable for products and services of that sector, if you were to create viable financial customs duty and tariff structure around spare parts and components of any sector, and if you were to ensure and encourage procurement of those goods through an ethical, transparent means, you are solving all the 4 problems. And therefore, the viewers may like to take a leaf out of this situation that any sector will may be made of ingredients, break it down, find out where the problem is. Pick that as your step 1. take where the problem is and find out why there is a problem. That is your step 2. And if you are able to create a bridge between 1 and 2, where the problem is, why the problem is, and put your energies and efforts, there is nothing that can be not done by a group of people who are selfless and driven. Now, what did we do? We did the exact same thing. We matched 1 and 2. While matching, we created something called AMTZ. AMTZ is today world's largest medical technology cluster, the only cluster globally that produces right from a mask to an MRI. India's first MRI, India's first superconducting magnet for MRI, India's first CT scan, India's first cardiac balloon catheter. Everything is being produced at AMTZ. At the peak of COVID, the requirement of RT-PCR kits for COVID in India was 12.5 lakhs per day. RT-PCR COVID test kits, which we started importing from Korea when the lockdown started on the 24th of March. And within a matter of 14 days, which is on 7th of April 2020, AMTZ launched its first kit with 3,000 kits production per day. The requirement was 12.5 lakhs per day. We imported at a huge cost, and we brought in the kit from India at 3,000 kits per day in 14 days. In a matter of 3 months, our production ramped up at AMTZ from 3,000 kits per day to 11 lakh COVID RT-PCR test kits per day out of 12 lakh kits per day that India needed. We produced over 11 to 12 lakhs COVID kits per day, 1,000 concentrators, oxygen concentrators per day, 150 ventilators per day, and we continue to produce MRIs and CT scans and multiple other products in this place called AMTZ. So what I'm going to do is I'm going to share my screen and show you a lovely video. But essentially, this video is the bridge between 1 and 2. Pick a sector of your choice, of your passion, find out where the problem is. 2, find out why the problem is, and do everything it takes to connect 1 and 2. So with that, I am going to share my screen, and please let me know if you can hear the, maybe I'll keep talking, then that would be better.
Yeah, you can.
This is the phase of construction, 2019. This whole campus was 2018. This whole campus was built in a record time of 342 days. It is world's largest industrial cluster greater than 100 acres ever built in 342 days. This is our 3D printing facility. All these centers are necessary to ensure that innovators, entrepreneurs who come, they are provided with the best infrastructure. And this infrastructure supports manufacturing of large number of medical devices, right from MRI to textiles, ventilators. As I said, medical textiles, Ventilators. The global chip shortage did not hit us because we make our own printed circuit boards, sensors, our own. These are the lines where millions of RT-PCR test kits can be made in a day, literally serving not just the country but the world. The innovation hubs where we provide right from exosome to tissue engineering and from BiPAP to ECG machine. And I'm sorry that video couldn't go through. I will share this link with the audience. Tissue engineering and organ regeneration, where we can plot cartilages, skin, grafts, artificial limbs, robotic hands, legs, mobile RT-PCR vans, which can go to nook and corner of the country, mobile oxygen plants, COVID container hospitals, 8-bedded ICUs made in 40 by 8 feet containers, shipped right from Taran Tarang in India-Pakistan border till Meghalaya and Mizoram. Oxygen concentrator lines which can produce almost 1,000 oxygen concentrators a day, supplied across the country, saving millions of lives. So I'm going to stop here. So essentially, I'm sorry that audio did not go through, but essentially, if you were to connect any sector into its ingredients, find out where the problem is, find out why the problem is in a very logical, systematic, academic manner, and then create a value chain which helps sort out those problems, you would have solved the problem itself. And I think we are simply an example of how a country which was totally import dependent on medical technology is now an exporter. Our products go all over the world, made by Indian engineers, technicians, biomedical technologists, and making India proud by being the only place globally which can make right from a mask to an MRI machine. The Kalam Institute of Health Technology, which is at AMTZ, is world's only WHO collaborating center for health innovations. And this is the only center in the world that can boast itself to be a WHO center for health innovation. So with that, I conclude what I have to share. Over to you, and feel free to ask any questions.
Wonderful, sir. This is amazing. I'm quite amused with the simplicity with which you have broken down the whole thing and explained to us in a manner that we would understand so easily. Your template of thinking is very interesting for me. I think you said, what is the ingredient? Look at where is the problem and decipher why the problem is happening, and then create a bridge or our value system which connects this 1 to 2 and then brings people, technology, innovation, and then solves the problems. And I think the result is in front of us. I think you have been with this, AMTZ as a founder and as someone who has given the backbone to the medical technology space itself here. I think it's amazing to listen directly from you. It is from the horse's mouth that we are hearing. I'm so delighted. And equally, I'm sure that all our participants are also delighted to learn these very nice eagle's eye view of a technique of looking at a problem and actually solving it. It looks very simple, but it requires tremendous depth of academic clarity and execution and zeal, and also pulling the resources from the powers that be to the large number of people who are willing to contribute and the talent and skill, and then making it happen. That's what you've made. Congratulations, sir, and extremely proud that you are with us today. Thank you. And I want to welcome Professor Sainath, who has joined a bit late. Professor Sainath, welcome to you. And you can, at any point of time, interact with Dr. Jitendra Sharma. You can just raise your hand. We'll open the window for you as well. But at this point in time, I would like to remind that we are getting into Q&A session right now. I invite Professor Prasad to start the cluster number 1, and we will go to cluster number 2 after that. Anybody would like to ask any question in cluster number 2, please raise your hands and we will make you talk to Dr. Jitendra Sharma directly, and that window will be opened and facilitated, right? So I'm quite excited as much as you are, and let's embark on this without wasting further time. Over to you, Professor Prasad.
Thank you, Professor Rao. Sir, it has been an extremely eye-opening approach. I mean, we have heard about software export zones. Now we're talking about a medical technology zone and how it has been put together. It is news to most of the audience. And I think the way you have come to that and executed what was necessary, the proof of the pudding is there right in front of us. So the first question, sir, is, can you tell us about your journey? What is your mission? There is a mission that can be seen in what is getting done. So can you tell us about it?
So the objective is very simple. Objective is global good. There are many ways to do global good. To produce a chapati for 2 rupees is global good. To have a tandoori roti for 200 rupees is global good. To do a free langar in Gurdwara is global good. You choose the measure in which you want to contribute to global good. Now, let me tell you that the most complicated medical device on earth is a linear accelerator used for cancer care radiotherapy. It's of the size of a 2,000 square feet room in a bunker with waves treating cancer. It's an extremely advanced biophysics solution. All the radiotherapy in the world is done using linear accelerator. There are only 2 and linear accelerator comes for about 16 crores. So it's not something very cheap. It is something which is extremely expensive. Now, linear accelerator, which comes for 16 crores or near about that amount, and you all know that cancer must be there in every country of the world. In fact, I have never come across a family tree in which somebody or other has not had cancer. There would be, it's a very global crisis. Different kinds of cancer, root cause is unknown. Non-smokers get lung cancer. Smokers may not get cancer. The pathophysiology is not fully understood. Smoking and alcohol does cause cancer, but there are others also who get it. Then there is leukemia. There are breast cancer, cervical cancers. You would be surprised to know that on the face of Earth, despite large categories and subcategories of cancer, there are 34 countries in the world that do not have a single linear accelerator installed in any of their hospitals. 34 countries that don't have a single linear accelerator installed in their hospitals for cancer care radiotherapy. And there are only 2 companies in the world that make this machine. One is in US and one is in Sweden. So bringing out a linear accelerator for half the price of what it is being sold in the market today, that is also global good. So the objective of our work is India should be a source of good quality, high efficiency, high safety, medical equipment supplier to the world for global good. Not just for business. Business is a byproduct of this goodness. The expansion in the sector is byproduct of that effort. But we should first be instruments of global good to the countries where 34 countries do not have a single linear accelerator. Imagine if CT scans were to be as cheap as a sofa. Perhaps they would be there even in most remote places. And that's our purpose. Objectively, our purpose is to ensure that at least 50% of India's consumption of medical equipment is made available through Made in India medical technologies at affordable costs. And if 50% of our consumption in India for medical technologies can be made available through AMTZ, and subsequently we become a huge instrument and force of global good to do the same in other countries, we would feel that we have met our objectives. We have documented this, including the massive journey of building AMTZ in 342 days, as well as the policy matters and our intent in this picture, which is seen if I close my video. It is a book which is available on Amazon called Made in Lockdown. The title itself brings a smile on many people's face because it is called Made in Lockdown. You see on the book, there is a lock and then there is an unlock. And the book is the story between the lock and the unlock that the world faced. So I would advise readers to also read this book and get connected with this mission of doing global good we are doing in medical technology. Malala Yousafzai might be doing it in girl education. Somebody might be doing it in dairy. Somebody might be doing in sugarcane research. And we should use our academic and professional training, our tribute and gratefulness to our teachers by being an instrument in this global good, whatever be the sector. Over to you, Mr. Prasad.
Thank you, Dr. Sharma. We are also keen to understand the first part of the question, which is your journey. I mean, to get to a mission like this, apart from the thoughts and ideas, there are a lot of values, a lot of influence, there's a lot of motivation, inspiration. Can you give us a brief on that?
Yeah, that's something I tend to hide as much as I can. But yeah, I have been a worker almost from the age of 9 when I started doing my first job. I used to sell Parle-G biscuits, Amulya, Horlicks, Dabur Chyawanprash, soaps like Godrej No. 1, Synthol. There is no product in departmental store which is not a grocery which I have not sold on my bicycle in shops from the age of 8.5 in West Bengal. And eventually I got a medical and engineering seat, but I did not have resources to study any of it. I was lucky to go to a charitable organization where education was given free, which is Satya Sai Institute of Higher Learning, where I studied. I was also lucky to go to AIIMS New Delhi on a training fellowship. And I'm absolutely lucky to have worked right from a primary healthcare center to the headquarters of World Health Organization in Geneva. And lucky to have studied right from University of Adelaide to Harvard School of Public Health in the US on scholarships. I have 3 academic PhDs, 4 masters and 7 fellowships, all done alongside work. I have never studied full-time, just studying. It is always with work. I am a hospital administrator by training and a medical technologist an health economist by more training and experience. I have seen the health system bottom up, right from a primary healthcare center to a WHO headquarters. I understand to some extent the bottlenecks which are man-made and bottlenecks that are neglected, unidentified. So there are two kinds of problems we face: problems which we have not identified at all, and problems which we have created ourselves. And in healthcare or in any sector, once you distinguish between these two categories of problems, it becomes easy. But the only thing that I would like to say about myself is I am absolutely 200% product of my teachers. I owe everything that I do to my teachers.
Excellent, sir. I think we've got a glimpse of the various dimensions from which the values and the rigor and the discipline and the understanding have come together to make what has been done today. In terms of the institution that you're trying to build, what, sir, is the agenda for the next 5 years? What are you looking at?
50% of all medical devices sold in India should be made at AMTZ, made in India, and should be at least at 50% of the cost than what we are buying it today. That 50-50 is our 50 months plan, which is 5 years. So we are working on a 50-50-50 plan. 50% of medical equipment in India to be supplied at 50% of its current costs in next 50 months.
I think very clear. What is needed to be done is very clear. So here, let me bring in the other dimension. I mean, a lot of what has happened till date is with respect to foreign technology from abroad. Now, when one tries to build one's own technology and, to get to half the price, there may be many methods, but when one is tackling a problem like this, how do you go about doing it? Can you give some insights, examples about how this is done?
So the first step is to ensure that we understand our role clearly. Our role is to build a product or a service. Our goal is to integrate a product or manufacture a product. Because look, automobiles, the spare parts and components come from 2000 automobile suppliers. Generally, a large automobile plant is only an integrator of automobile spare parts into a fully fledged, well-functioning, tested, beautiful, safe vehicle. If an automobile plant starts to build their own sensors or a windshield, that's not the job. A glass panel on the best of the car or the cheapest of the car will come from a glass supplier. It could be Saint-Gobain, or it could be Acruz, or it could be someone. But you don't go as a car supplier to start building glass. So we take a problem, we take a technology, we understand what should we be doing, what is it that we can rely on affordable sources from other sectors. We do what we do in the best of the places. Medical technology, AMTZ, is considered to be a benchmark. People come here, we help them, we provide them with the spare parts and components for their first 5 prototypes. That's again a problem. You know how to make a dialysis machine, but you cannot afford to buy the spare parts and components required to make one dialysis machine. Imagine if I were to supply those. You will end up making it as an innovator. We do that. First, we realize that startups and entrepreneurs, they lack the financial muscle to even build their first 5 prototypes. They risk their lives and their financial security. So we support them, we test, we tell them what not to do. We tell them where they can rely on others, and we get them to success.
Yes, I think the clarity is again very much there. First is in terms of what we should be doing, what we should not be doing. And then to the extent possible, facilitate it for others to do. This is what the role that the zone is carrying out currently. Thank you, sir. The next query is about the phygital dimension of healthcare. A lot of information technology is also coming in. So in terms of phygital healthcare, there's a question about what its pros and cons are and what do you think can happen in a country like India?
There are two parts to it. Part one is use of data. Because you make something into digital because it's a repository of a trend. Trend is nothing but a precursor to your strategy. Now, what kind of data is useful? Measuring blood pressure every day is a good data to have. But storing it for 5 years, does it help you? Maybe, maybe not. So in the mad race of digital, we have also become adept to amassing garbage data. We are simply collecting data. Not all data is useful. I measure your temperature 6 times a day for 6 years. What's the use? If I measure your triglycerides or HbA1c, measure the trend of your blood sugar, it's of use. So, in the mad race of data, let us also again see what's useful, what is not. The second, what is useful if we were to create the data bank using digital technologies? What is it used for? And for it to be used, in what format should it be? Now, there are different medical technologies and different medical technologies have different kinds of data. For an example, an X-ray will be an image. An ultrasound will be a video. It requires DICOM compatibility, which is not applicable to X-rays or CT scans. A blood report will be numbers. It will be a report, simple piece of paper on a screen. An ECG will be a trend. The formats of this data should be such that it is harmonizable. You store an ECG trend in your computer, and Dr. Sudhakar ji stores an ECG trend on his computer. The back-end format should allow them to be known to each other. And therefore, in the phygital dimension, let us know that not all data is useful. Let us grab the data which makes sense and not be in the mad race. Two, take it in a formats that's useful and compatible to others. In healthcare, these fundamental principles help us a lot. There is another principle which we are exploring. We are setting up an AR/VR hub. We have given few licenses also to ICFAI for their startups, to ICFAI incubator. Imagine a spinal cord injury patient or a paraplegic patient. Exercise would help them tremendously if done in a guided way. The worst thing about bed-bound patient is to take them to a hospital. The logistics, the car, the vehicle, the auto, the path on which their wheelchair would move, everything is a challenge, plus the risk of infection in the hospital. Imagine I create a paraplegic center with a guided therapy room with the best of the machines, have a trainer which is expert in spinal cord injury or bedridden patients therapy, send an augmented virtual reality glass to the patient at home. The patient wears it, imagines himself or herself to be in the therapy room and does guided therapy. That's phygital. And we are working towards that. So we should be extremely relevant to our end client. This is again a lesson for all sectors. I'm repeating this because I know ICFAI is not just medical. It encompasses a large number of fields. Whatever I'm sharing must be relevant to you. People must understand that your glamour of being funky, being phygital, is less important than your true use for your end client. Your end client must find what you are doing relevant. And that is the first approach to choose from the phygital world what is useful, what is necessary, what is desirable, and what is cosmetic.
I think again the clarity is coming through extremely clear. The client at the center, and the relevance which is measured in terms of what the client wants, which obviously will differ based on the context, an Indian context which is very different, and then deciding what is to be done, what is not to be done, and defining technological aspects, for instance, format being one of it, in a manner in which it can work through for utility into the future. I think it's coming through very, very clearly, sir.
Thank you.
Yeah.
Maybe we can take also questions later on, because I will need to.
Certainly. So I'll end the cluster here and I'll hand it back to Professor Rao.
Thank you, sir. Thank you very much. We are quite amazed. Not only did we know earlier that you are contributing in a big way, but the way you have been summarizing and making it simple for us to learn as a true leader that is what is actually making this session a blockbuster session. Everyone is making notes and enjoying the way you are making it very, very clear. The vision and the mission, the lesson number 1 to lesson number 2 to lesson number 3, I think everything is falling in place of a higher order learning for us. I think it's amazing. I will very quickly take a couple of questions and then I will honor your time, sir. Ladies and gentlemen, if you really want to ask any question, please raise your hand. I will give priority to that. In the meantime, I will go through with the questions that I have with me. Sir, the first question is, to what extent does privacy and security issues hamper adoption of technology in healthcare?
Right. So privacy and security is the fundamental right of the original data which belongs to that patient or that person. As long as that is in the control of the person to whom it belongs and shareable across the people to whom the patient or the citizen wants, it's safe. But its blind use is unsafe and could be unsafe not just at this point of time, but in future also. Now, the best way to do that is to have, and again, IT world brings out its own firewalls and barriers to privacy, so that the privacy is safeguarded. But look, when a patient is on a bed, there is no privacy at all. The nurse needs to know, the ward boy needs to know, the doctor needs to know, the pathologist needs to know, the dietitian needs to know, the physiotherapist needs to know. So you have a world where everyone needs to know about you, but should not misuse you. That's a very brittle balance. That balance can be safeguarded if the technologies we use allow it for controlled use and allows patient to own the data. For example, we go to 1,000 places and give an ECG. How many ECG machines actually share the graph back with you on your cell phone? None. Why? It belongs to you. The ECG machine should come with an inbuilt feature of sharing it with you, ensuring that it is not available to anyone else. That balance in medical technology is very important, and we are gradually getting there. But the fundamental principle I want to share is, in your segment, in your sector, particularly in healthcare, data is relevant only if it can be used. But it is relevant only if it can be respected. And therefore, controlled use and ownership of the data with the person to whom data belongs, and not to an external party like a hospital, is the fundamentals of ethics in data governance.
Amazing, sir. Amazing. Once again, wonderfully you simplified. I think privacy is a fundamental right. That's what you have actually emphasized again in this response. Second is that there should be a controlled use, and also the belief and practice that the owner of this data will have to be honored and respected. So, and shareable features are missing, actually. I mean, that looks like a gap and an opportunity at the same time. So I'll quickly move to the next question. That is, there are a lot of wearable medical devices these days which record and send data to apps. Are they safe for human bodies?
Broadly, safety is looked at technologically in two aspects. I wear a Fitbit. There are two kinds of unsafe things that we have to look at. One is the safety of the biomaterials or the materials which have been used. That's called biomaterial safety. Second, the safety of electrostatic discharge, electromagnetic interference coming out of the electrical framework within the machine. Now, the biomaterial safety is tested as per ASTM standards globally. And the electronic safety, the surge current, the battery discharge, the leakage, the ingress protection, there are thousands and thousands of tests. We test it in our lab as well. Is validated against the IEC standards given by International Electrotechnical Commission. So the short answer to your question is device is safe if its biomaterial safety and EMI, EMC, ESG testing has been taken care as per the standards with permitted thresholds.
Great. So the lesson for us is to watch out if those products that we are using are tested and certified by these bodies, both for biomaterials that are used as well as electronical safety or the electrostatic discharges that these devices emit. Wonderful. It's quite eye-opening, actually speaking. This is for use of end consumer, and the answers are directly useful, sir. Thank you so much. There is one question from dental innovation. I believe there is a dentist also in the audience who has asked this question. Dental technology innovation, how is it in present and what is the outlook for future? Briefly.
So if you look at dental from two parts, the dental chair, the dental X-ray, the OPG, the dental instrumentation tray, it has not changed for 40 years. Yeah, the chair might be having a better cushion now, unlike old time saloon under the tree dental chair. But there has been no innovation on dental chair. But there have been lot of upgradation on the implants that are used and the nature of those implants. The safety, the longevity, the durability, the weight, all that has been worked upon. So the answer is no and yes. There is a segment of dental work which has seen no innovation. And there is a segment which has seen great innovation. But let us connect it back to society. Imagine an 80-year-old grandfather who need not come to a dental chair to do cleaning or filling. Are we able to provide him a dental chair in a Tata Winger or a Swaraj Mazda vehicle? Can there be an Uber or an Ola of dental chair? Which means we need to connect science to society. So innovation which has not happened for 40 years on dental chair need not happen for next 40 years because a dental chair will be a dental chair. Innovations have happened on implants, they can continue to happen because it impacts the durability, longevity. But what about the innovation that can bring these two to society? We have the responsibility to do that as well. So I think I am leaving some thoughts for the audience. Yes. We will be happy to support them, but then there is a lot that can be done.
I'm sure there are a lot of youngsters who would like to reach out to you, and we'll try and facilitate that. If this opportunity can be actually captured and more soul-searching questions and more exploratory questions to move forward are asked, and you are the right person as a health economist out there for all of us, sir. Thank you so much. I'll move to the next question and then quickly keep Dr. Saumen Mukherjee to ask the question, Srikanth, and in the meantime, I'll take one more and then we'll save some time. Do you agree that health sector in private got too much commercial by reducing, by compromising on values or human values? How do you look at this particular statement?
So look, a society is made of private sector, public sector, NGO sector, charitable sector, right from missionaries of charity hospital to Ramakrishna Paramahamsa Hospital to Satya Sai Hospital to private hospitals like Apollo's and Fortis's and Max Healthcare to All India Institute of Medical Sciences. All of them are part of one society. When we all are part of one society, it can never be that degradation is happening only in one pillar. Because the doctors which go into all this come from common medical schools. The drugs that are sold in these hospitals come from common factories. The machines that go into these hospitals come from a common place like AMTZ, either here or elsewhere in the world. How can ethics get impacted only in one sector, in one segment? It can never be. Because it is we humans who work in a private sector today and corporate sector or NGO sector or government sector tomorrow. And therefore, more important than challenging private sector or public sector or NGO sector for lack of ethics, we must find out first what is wrong. I'm going back to my presentation. This question is starting on a wrong foot. It is trying to identify where it is wrong. First, find out what is wrong, why it is wrong. Then you find where it is wrong. Because where it is wrong, you might be seeing mud on a tap, but tap is not producing the mud. Mud must be coming from the reservoir or the dam or a canal, passing through the pipeline and coming out of your tap. And therefore, I will request the requisitioner of this question to first quality check this question and find out what is wrong, why it is wrong, and then go to where it is wrong.
Amazing. Find out what is wrong, and once you find that out, go for the why, and then probably subsequently we can look at the other part. Amazing.
Even if we
in a society which is affected by all these people who are ingredients of the same society, it cannot affect only one sector. I think that's the giveaway, that's the takeaway for all of us. Yes, sir.
So there must be something which is impacting everyone. What is that? Is it our inability to pay for healthcare of every citizen in the country? Is it poor quality education? Is it low density of seats? What is wrong, right? Because it can never be that the muddy water is coming out of only tap when all the water is coming from the same reservoir called India.
Absolutely. Absolutely. Is Saumen Mukherjee ready to ask the question, Srikanth? In the meantime, I'll take one more to save time. Sir,
if we can conclude,
somebody wants to build a medical device brand in a 2-tier and 3-tier cities in India. How can one go about doing that?
Yeah. So if you want to build a brand, this question needs to be qualified by knowing whether that product already exists or it does not exist. If it exists, to build a brand, you need to pass through the certifications, take international equivalents, and do a good marketing. If it does not exist, before building the good brand, you should build the good product. I think in short, that is my answer.
Amazing. Thank you very much, sir. So, Dr. Saumen, would you like to ask the question?
Sir, he left the room, sir.
He left the room. We'll move to Lavanya. Lavanya has a question on AI. Where do we draw a line between AI and technology and doctors?
After that, we would like to conclude this because I have a hard stop with something.
This is the last question, sir.
I'm enjoying this, but I have other things which...
I respect that. I respect that. We don't have to wait for Lavanya to come on the line. The question is that where does one draw the line between AI in technology and doctor's decision?
So again, that's a very encompassing question. All I would say is, as long as AI is a tool for the doctor to take better decision, it's a tick mark. If AI is a substitute for doctor's decision, it's a cross and a double cross, because that discrimination to treat a patient, if given to AI, can cause havoc. So any technology, not just AI, so long as even robotic surgery, it is the robots who do the surgery, but the robotic control station is in the hands of a trained surgeon. So long as a technology is a tool for the human to treat another human, it's a tick mark. if it is endeavored to be a substitute, it's a cross and a double cross. Should never be done.
Amazing, sir. Amazing lesson there again. I think technology or a tool should be used to solve some problems, but ultimately the decision is controlled by the doctor. Doctor's control and doctor's decision cannot be substituted. I think that's an amazing lesson here. Upholding.
As simple as a university. You use a laser. Earlier we used to use overhead projector, then came laser. Now we use video conferencing. But have we substituted the teacher? No.
No.
These are tools for teachers to touch our minds better, for students to recap the lessons better, but they can never substitute a teacher.
Amazing, sir. It is coming from a delight of a teacher. You are a delight of a teacher. Although you claim that you are a product of your teachers, there is a fundamental fit here in terms of your humbleness and gratefulness to your teachers. And at the same time, the amazing sense of contribution that you're bringing to the table, and you're inspiring all of us. This is a delight of a teacher or an institution which has built you. That's amazing. The country is actually proud of you, sir. I'm going to take only 1 minute to summarize the big lessons for want of time. In fact, everything is so crystal clear what you have discussed today. There is no need to summarize, but just for those who have joined a little late, for your benefit, I will say that any sector, if you're working, look into the segment very carefully, understand what is the problem, where is the problem, what is actually causing the problem in terms of the inputs and the ingredients. Then you will have to look at resolving that problem by application of resources, both people, non-people, with some kind of strategy kept in place. That's an amazing lesson that we have learned. Whatever you do, the other one is whatever you do, make it extremely relevant to the end users. If it is customer centric, if it is end user centric, then everything will fall in place. The issues of privacy, the issues of ethics, the issues of being commercial and non-commercial, they're all relative. But if it is viewed only from the end user's point of view, I think things will fall in place. And jumping to blame one particular sector at the expense of other is actually unfair. We are all in the same society, same ecosystem, and the root causes can be found better by having benefits for everyone in the ecosystem rather than one single particular sector. And when you are embarking as an entrepreneur on making some new products, on new ideas to actually business fruition, when you are actually trying to solve problems that humans are facing by reducing the costs, we can always look at AMTZ as an inspiration, as a model, and as a template, and we can all reach out to Dr. Jitendra Sharma in his amazing journey. He himself said that he is a hospital administrator by training, and subsequently emerged into being a health economist and a medical technologist as well. The clear vision and vision statement that you have explained to us actually talks about the amazing level of clarity that you have in your mind, sir. Therefore, all the responses that you're given and all the things that you're actually doing on the ground are matching. I'm quite delighted about this fact. 50% of the medical technologies that we are using in this country, consumed in this country, should be made in this country. Second, that is the first 50. Second 50 is 50% of the current cost it has to be reduced to. And the third 50 is make it in the next 50 months. I think this 50-50-50 mantra is what stays in my mind very, very strongly that you mentioned. I am today, along with all others, is extremely proud of hosting you, where you have displayed the connect of science to society as a champion and as a leader, your academical brilliance in looking at the issues, your missionary zeal in making something work in 342 days, which is a world record, and your problem-solving acumen. You are a true icon of Wise Views leadership lessons. Extremely thankful to you, sir, on behalf of all of us.
I'm privileged to be here, thankful for the opportunity, and I think all the audiences, all the people in the audience that are listening, they must never forget that they are products of their teachers too. And it is just by their effort that they can truly demonstrate the gratefulness that they can exhibit towards their teachers. That's all.
Amazing, sir. A true student and a qualified student who has such sense of responsibility is a true nation builder. Thank you very much. We would like to end this week on this, and thanks for your time and expertise. I wish you happy Navratri, good festive times ahead to you and your entire team that is coordinated with us. And I also want to not forget Dr. Sainath for connecting us with you. And it's worth waiting last 5 months to get your time. I really enjoyed interacting with your entire team, sir. Thank you so much once again.
Thank you. Jai Hind.
So ladies and gentlemen, we'll see you next week on Friday at 4:30 p.m. We are going to be talking about electric vehicles, the mobility, what are the potential that we have and what we should watch out for. Again, we will connect with you on 7th of October. Mr. Uday Narang is going to talk about his amazing leader, and we will present that leader to you at 4:30 p.m. on October 7th. Wishing you happy Dasara. Have a great time. See you next Friday. Bye.